Welcome to Health is Wealth with Dr. Mike. I'm Station Manager Tina Cortez, and my co-host is Dr. Mike Carrozza. Good morning, Dr. Mike.
Good morning, Tina.
Okay, so we're going to continue our focus this week with heart health and specifically women's battle against heart disease. Where do you want to start?
Well, I think it's fair. I mean, February is Heart Health Month, so this is important. And I think what's the most important idea is that, you know, we start talking about heart disease, cardiovascular, when we started our, if you will, our trek in February to discuss and try to help this battle of heart disease. I think it's important to discuss women's health pertaining to cardiovascular disease because they're a little bit different and they have different risk factors. And the idea is we want to safeguard from these because some of these things we can actually prevent. And that's the whole idea with heart health, right, Tina? It's all about prevention. Yeah. So, I mean, first of all, heart disease and stroke affect 31,000 women in Canada. They die annually. It's pretty sad.
The numbers are huge.
It is a large number, and it's astounding. I mean, at least one of these risk factors include things like your ethnic background, the fact that you are in menopause or not, and diabetes. So for our listeners out there, some of people would probably say, wow, I didn't realize going into menopause besides
is
just
automatically a risk factor?
Exactly. Except just hot flashes already that are annoying. You're not sleeping, but now you're at a predisposed risk for heart and stroke. And let's talk about what these risk factors are and then why. And so we're going to dissect this. So basically, you're safeguarded from heart disease prior to menopause because you have this estrogen. This estrogen is actually protecting you. And between the ages of 12 and 50, of course, when it starts and your menstrual cycle starts and then towards it dwindles away. But the premenopausal women with diabetes, for example, this is when it cancels it out. Because having diabetes on its own is an independent risk factor. So what's happening is so if you're premenopausal and you have this estrogen and then you have diabetes, it cancels it out.
Cancels it out.
Yeah, so now it's not a protective.
So while the estrogen is helping you, the diabetes is working against you, obviously. Correct.
And it's one of the reasons why, you know, if you look at some of the data and the research, a lot more men pass away from heart disease prior to their 50s than females. Females a little later. That's because the menopause kicks in. So let's talk about the role of estrogen and how it actually can help, if not, and then as it declines, it can actually cause detriment. So estrogen provides this protective effect on women in terms of their heart health because it sort of controls things like cholesterol. So, but one thing that could happen is that if you're taking an oral birth control pill, so for the most part, birth control pills back in the day, we're talking like years ago, like 10, 15, 20 years ago, had a lot of side effects. For now, and this is me as a naturopath just saying open and honest and telling you exactly what the literature portrays, is that it's actually safer now than it ever was. So it's because they've done a lot of changes to it, but there's still a small proportion of women that take the oral birth control pill and actually it predisposes them to an increase in blood pressure and blood clots. Now, if you smoke, for our listeners out there, if you are a smoker over the years of 40 and on an oral birth control pill, you need to talk to your doctor. Do not disclose this to your family physician. This is extremely important. The fact that you're smoking actually is going to interact and increase the risk factors. And then this is where it becomes a troublesome area. So it doesn't interfere with it interferes with the drug and then will actually cause and push forth heart disease. And I know some patients in my office, I know a lot of patients that have had this issue happening, over 40, smoked and then took the oral and had no idea. So just really look at your risk factors. Look what you're doing. If you're taking a drug, just make sure you understand the different side effects. And you're not supposed to smoke during it. And your family doctor will mention this to you. This is extremely important. And then, you know, let's talk about pregnancy in itself. Tina,
I wouldn't think.
Would you think that getting there's already so many other things that come with pregnancy, but now you can actually die from a heart attack. Isn't that crazy?
It's a bit shocking. And what is it about the changes that are happening to your body at that time that make you at higher risk?
So a couple things. First off, the idea is I see a lot of obviously prenatal moms, and before they're getting into their before they're getting into the role of being a mom, of course, and maybe they're trying to get pregnant, etc. And so I always instruct my patients to get their body to where they think is going to be optimal. You really, for this time, and Tina, you know best, of course, you really need your body working. You need it working optimally. And you really want it, so you want your body composition to be optimal. You want your cardiovascular system working, and your lungs. You want everything working very, very well. And of course, things like your blood sugar also need to get stabilized, because gone are the days to say, hey, I'm pregnant now, let's just eat everything under the sun. It's very important that we don't do this, because these are where the risk factors come in. The first one is preeclampsia. Now, preeclampsia is an increased blood pressure. This is a blood pressure problem. And again, when you have increased blood pressure, this is a risk factor of cardiovascular disease. And this can actually cause problems to a mom, or a pregnant mom. And so what happens is you need to get your blood pressure monitored regularly. And this is why you do your checkups with your family doc. And, obesity is a big one here. In terms of, if we're talking about risk factors, obesity is a big one. That's why you want to get your body sort of optimal. You want to start working at getting your body to the proper body fat composition, because if you start off a little bit obese, this is going to increase the likelihood of two things: this preeclampsia, and then the next topic we're going to talk about, which is the gestational diabetes. Gestational diabetes is not like type 1, type 2 diabetes. This is gestational. This is what happens just when you're pregnant. So this is when, obviously, the insulin, actually, your body must produce extra insulin when you're pregnant, because this is how you can carry a baby. So the blood sugar levels start actually rising, and then your insulin cannot keep up. When that happens, that's gestational diabetes. Now, you can get tested for this. And this is, you remember the sugar challenge when you first got pregnant? That's
Yes.
the first thing they tested you for. And they probably make you drink a whole bunch of sugar and then do the challenge. They want to just make sure that this is accounted for, because there are medications you can take for this to sort of prevent, right? And then sort of, this is going to predispose the mom and baby to diabetes later in life. So most of the time, actually, a female who ends up having gestational diabetes while having a baby, the baby is going to get predisposed to diabetes, so potentially that child can actually go on and have diabetes, and the mom. So, it's putting a lot of things at risk, and this is really easy to ward off. I'm obviously it's easier said than done, but the research is out there. Activity, exercise, diet and lifestyle, and just keeping your body in the optimal range in terms of the fat composition, I think, is going to be important. Now, there's a high risk during childbirth, of course, a few months after, to having heart attack or a stroke. So it's obviously, and this is more of the vessel malformations that happen, as we discussed about the preeclampsia and the diabetes, because it just drives it. So, when you have a risk factor, so cardiovascular disease, let's say you have a family history of cardiovascular disease, that already puts you at a risk. So it's like, my family has heart disease. I have risk factors for cardiovascular disease.
Just automatically.
Automatically. So then I have to do things in my life to cross out or cancel out these risk factors. And how I can do that is, diet, lifestyle, nutrition, right? And this is what we talk about to sort of cancel this out. And then we'll talk about, some other pointers for some women out there that can really do some benefit. So in terms of peripartum cardiomyopathy, I want to talk about this. This is PPCM. And this is enlargement of the heart. And this is actually, the heart becomes too large, and then it weakens the muscle, and then the pumping becomes difficult, so then it can't circulate enough to help the vital organs and actually supply them with blood supply.
And how is this diagnosed?
This is actually, it's rare. But it actually, back in the day, there was a lot of deaths that, a child, moms used to pass away
during childbirth.
I don't know if we can go through it in our lifetime now. I don't know anybody, but back in the day, our grandparents, it's like, what happened to your grandmother? Oh, she passed away after the birth of her eighth child or something. These are what happened. This is complications. Ideally, the idea is we want to just help educate moms out there, educate females, really just get them really strong, and you want to get their cardiovascular system in check. So another thing we're going to talk about, which is probably the most important, is menopause. So your risk of heart disease and stroke, of course, increases after menopause, as we spoke about earlier. Now, how? What does it do? Well, it causes the bad cholesterol and your total cholesterol to go up. But not only that, it causes the good cholesterol to go down. So all of a sudden, now you have separate independent risk factors alone just by the cholesterol. And we know the cholesterol story in terms of cardiovascular disease. Now, in terms of, the other effect is that we talked about preeclampsia in terms of pregnancy, which is elevated blood pressure. In terms of menopause, the blood pressure goes up for females. And again, this is an independent risk factor. And then not to mention the central obesity in terms of fat adipose tissue. So the weight gain goes up. So we start seeing weight gain, the fat tissue. These are all independent risk factors, and that women have to compensate. So, and this is where you get blood clot problems, and then, the symptoms are just severe sweating and sleep deprivation. But my point is this. I think it's important to mention this, I had a patient come into my office one day, and she said, Dr. Mike, I went through menopause, the hot flashes, I did it all. It's all, it's all gone and clear, thankfully. But I had high cholesterol, and so my doctor put me on cholesterol medication, and I'm so happy that I can still eat what I was eating 20 years ago, and I'm not having a problem with, I can still eat all the fatty foods and all the fried foods and all my cholesterol. And I looked at that patient and I said, wow,
oh boy,
she's not getting the message. I mean, for those of our listeners out there that are on statin drugs to lower cholesterol, don't be fooled, because, you're not just, that drug is not just protecting you, so you can't go eat what you want. And every medical doctor, every family physician, naturopath, any doctor you go see will actually tell you need to engage into some form of lifestyle modification. You can't just rely on this drug. I don't care how high the dose. And the point is that you can't eat like you were, at 55, like you were when you were 40. Unfortunately, your metabolism is slowing down, the cholesterol is elevating, and your estrogen is just not working to protect you. So what are you going to do? And then you're going to get that central obesity, because the statin drug's not going to make you skinny. And that cholesterol-lowering drug is not going to make you skinny. It's going to help your arteries. It'll help with longevity, because that's what the studies show. But there are things you need to do.
Okay, so we've talked about the risk factors. What about some of the things that we can do to prevent and reduce the risk of heart disease?
Well, there's a lot of talk about hormone replacement therapy.
It's not an option for everyone.
It's not an option. So there's HRT and then there's BHRT. Here's the deal. I mean, we're going to talk more about this in our next segment, but biological or bioidentical hormone replacement therapy versus hormone replacement therapy, which is the synthetic one, giving estrogen to the body doesn't automatically protect you now, because this actually counteracts and can cause other issues such as cancers. And in fact, it actually increases the risk of stroke and heart disease when you have HRT. Now, BHRT is much better. This is the bioidentical hormone replacement therapy, so this is more from nature. This is more wild yam sources, and this is how we can increase through things like progesterone that will actually increase naturally the estrogenic effect. But we don't want to just start pumping estrogen into women, because that's going to cause a whole other slew of issues. And I think when we talk about the cholesterol problem, this high cholesterol can be an issue. So I want to just cite one study, Tina. It was really important, and this is the JELIS trial. This was done back about 10 or 15 years ago. And this study came out, and I'll never forget when it came out, because I was a researcher at the time. This study was one of the longest and largest clinical studies in the history of natural medicine that actually showed that when you take fish oil in conjunction with your statin, your cholesterol-lowering drug, it will actually decrease death and cardiac death significantly. So it would add to it. It is good news. It is good news, because we always talk about natural medicine on the show. We always want to talk about prevention. And it's nice when conventional medicine comes together with natural medicine and preventative medicine to say, hey, look, this is a triumph. This is something that is extra strong when you take it together. And it was the only study in its kind, and it actually proved to be beneficial. So the point is that, my next topic is about triglycerides, because as females increase their and in menopause, that is, when they increase their cholesterol, their triglycerides go along with that, and this is that fat, that large sludge fat that actually leads to increase of cholesterol as well. And then if you have this high triglycerides alone, it's an increase in heart disease, stroke, and especially in females. So what you can do is you can take an omega-3 fatty acid from fish. Now, it doesn't have to be from fish. If you're a vegan or vegetarian out there, you can take a wonderful vegan source. The idea, it has to be rich in DHA and EPA, and we can get this. So basically, we're going to talk about lifestyle changes that can actually give you a fighting chance, and we'll talk a little later, and we'll speak with a cardiologist to talk about this. But things you can control: smoking. You can control high blood pressure. You can control high blood cholesterol, diabetes, physical inactivity, and obesity. This you can all control. We can. We know what the research is out there. We can control this. What you can't control is your age. Unfortunately, you can't control. You can't control your ethnicity and your family history. And of course, you can control your gender. That's something you can't control. So the points I want to have for some of our listeners out there, especially our female listeners, is continue to become smoke-free. Really think about not smoking and trying to quit smoking, because that's going to be number one. You want to continue your healthy body composition and really look towards eating a healthy, balanced diet that's not going to predispose you to having diabetes. So balancing out your proteins, not carb-rich, and you can maintain a healthy weight. Physical activity for at least 150 minutes per week, Tina.
That seems like a lot.
It is a lot, and it has to be in increments of 10 minutes in terms of this vigorous intensity in these intervals. My point is this, is that, whether you work out 3, 4, 5 times a week, you have to get active, and I think that's getting your body and your cardiovascular disease and sort of prevention in check. And then healthy blood pressure comes along with that, so that those healthy lifestyle choices, and then whether
will go a long way.
Will go a long way, whether you need medication or not, but there's a lot of dietary lifestyle medications that you can take as well. And so a healthy diet to lower fat, high in fiber, okay, that's something that is going to be extremely important. So discuss this with your healthcare practitioner and somebody you're seeing, because, you can control the high cholesterol, the blood pressure, and the diabetes. Okay,
we're going to pause right there. When we come back, we check in with the Heart and Stroke Foundation. This is Health is Wealth on 105.9 The Region. Stay with us. You're listening to 105.9 The Region, and welcome back to Health is Wealth with Dr. Mike. And Dr. Mike, we've got a guest joining us today.
Yes, Tina. We have Dr. Sharon Rambahar. She's a spokesperson for the Heart and Stroke Foundation, and she's also a cardiologist at Mackenzie Health, and she's also an adjunct assistant professor in the Division of Cardiology, Department of Medicine at the University of Toronto. Welcome, Dr. Sharon Rambahar.
Thanks so much, guys. Great to be here.
So we wanted to focus today first on, women and heart health, and talk a little bit about the report, A Fighting Chance. What can you tell us about it?
So it's interesting. The Heart and Stroke has put a lot of effort into looking at heart disease in women, which is the number one cause of premature death for women in Canada. And we've made such progress. It's a great time to have heart disease, if you could say it in that way, because we've made gains in medicines and technologies to diagnose it. Unfortunately, women are 10 times more likely to die from heart disease, stroke, and related vascular conditions than things like breast cancer that they might not be aware of. And so right now we're looking at increasing awareness into the differences between men and women and focusing on research so that we can give women a fighting chance and help reduce this gap and close the gap of heart disease in women.
Well, I love that. I mean, this whole segment's about, so we definitely have just showcased this particular show just based on women and cardiovascular disease. And so it's so wonderful how, obviously, we can showcase this in this segment. But most importantly, we mentioned some of the big differences, I think, being, and risk factors, but just being pregnant and then even actually in menopause, and how the estrogen will sort of protect some females. And then when they're in menopause, this just goes away and this actually becomes an independent risk factor. So is there, I obviously some women didn't even know. I remember I mentioned this to Tina on the show today, and she was like, wow, I didn't even know that. So again, it's more about this fighting chance, this topic about what women can do in terms of, obviously we can't, our age, our gender, our ethnicity, we can't sort of pick, but there are variables that we can control, right?
Absolutely, absolutely. And so what you've highlighted, I want to touch back on that again. Women who are pregnant and the whole spectrum of their life experience, they can become pregnant, they can have menopause. These are things that do not happen to men. And for many years, it was just assumed that the research that applied to men would extrapolate to women. We could just say if it happens in men, it'll happen in women. And what we're realizing is that's not true. And the researchers actually were not permitted to include women in early clinical trials of heart disease, and the reason was because of that thalidomide debacle that happened back in the 70s. And women who got morning sickness medication had children with very severe birth defects. So women were actually excluded from all trials until about 1993, which when you think about it is when the Jays won the World Series, and that wasn't that long ago. And so now we're sort of playing catch-up to try and figure out what are the unique factors that cause heart disease in women. And we know that the usual risk factors, which are heart disease from cholesterol, smoking, abdominal obesity, blood pressure, diabetes, and things like lack of fruits and vegetables and stress are a big issue. But in women, certain ones are a bit more potent, and those are things like smoking, high blood pressure, and diabetes. They're more potent risk factors in women. And then things that affect women exclusively, like preeclampsia, eclampsia, things like lupus and rheumatoid arthritis affect women disproportionately, these inflammatory autoimmune conditions. Early menopause, and these are big problems, and people may not necessarily realize this. And then throw into that mix, as you mentioned just now, the impact of ethnicity. And we know that in Canada, with our specific ethnic mix, people of South Asian descent, Indigenous people, Afro-Caribbeans, and Chinese individuals not only are less aware that their risks are higher, but there are significant gaps in higher risk factors in those communities.
And that's awesome. So thank you for that. That's just a huge wealth of knowledge. I mean, I want to go back, and you mentioned about 1993. It's so interesting because when I did my research at the University of Guelph, and we actually picked our population because during the thesis and the trial, the clinical trial that we put on, it's interesting. I mean, I think they sort of went to 1993 as saying, no, we can include we can now include, after 1993, we can now include females. It's interesting because when I did my research in 1997, there was still a little bit of a stigma, and I wasn't able to use female subjects. It's interesting. It's very interesting. And now that, because when you mentioned that, it really hit home to me because, I asked my my supervisor at the time, and I said, why can't we use females? Like, what's the problem? We have about 10 or 15 of them. It's just, no. Can't. Just it's better that we don't. That term,
potentially pregnant, right?
Yeah.
Any woman of childbearing age was potentially pregnant.
Exactly.
And then you're losing the wealth of information from that physiologic stress test. Think of all the changes that people undergo through pregnancy. Like it's no surprise if we didn't know about it and then we detect it. And what's astonishing to me is that the American Society of OBGYN just documented that maternal mortality from heart disease is the #1 cause of maternal death in the U.S.
Wow.
In 2020.
Wow.
It's shocking.
So it's still, it's real. And this idea, this fighting chance report, I mean, I think there's also, it's basically, I guess this campaign has been over a couple of years. Is that right?
Right. So the first phase was back in 2018. The Heart and Stroke released a very important landmark paper called Misunderstood, basically articulating what's going on right now, the gaps and how we can fix it. And now what we're noticing is momentum is building, and the funding for heart disease and stroke research is yielding results. And so they're actually seeing the changes in research awareness and donating the money to the research at the front lines. They're now noticing some changes and improvement in that. Basically, Heart and Stroke has mandated all funded research consider sex and gender-based analysis and reporting. And in the last 5 years alone, the number of funded research projects, including this, has increased by 30%. There's national research networks that have been created, an Ottawa National Conference, and talking about this. Scientists are actually looking into these issues, and a lot of female scientists research has actually shown that women scientists are more likely to focus on issues that are related to women and can help the field advance forward.
And Dr. Rambahar, just before we wrap things up, if we can go back and talk about the symptoms for women and how they're different from men.
Well, when you mean
That's
symptoms, I think symptoms and the signs of a heart attack in general, yes. That's an awesome.
Right. I think that's a really important public awareness thing. awareness is key. This is the kind of thing that we hope people have conversations about if they hear it on the radio, and they'll remember if it happens to someone they love or near them. And the most important thing to remember is that the most common symptom in men and women when you have a heart attack is chest discomfort. And because what heart attack is an artery which has a cholesterol blockage that bursts and causes a decrease in blood flow to a segment of the heart muscle. However, women are more likely to have atypical symptoms and can describe their symptoms differently. And that could include saying chest discomfort, which sounds like semantics, but heaviness, squeezing, pressure, or burning, maybe discomfort in the upper body, shortness of breath, things like sweatiness or heart racing or nausea or indigestion, decreased appetite, lightheadedness. And why this is important is that nearly 2/3 of women who die of heart attacks have no chest pain. They may have lingering symptoms that they didn't recognize and delay going in to get care or get attention or get assessed. And then they have a greater risk of sudden death and experience this.
And to some extent, like this fatigue, this extreme fatigue can be just even an only symptom, correct?
Absolutely. And so when you think about it, the heart muscle, if it doesn't have any blood flow, fatigue could certainly be that. The other thing is women may also be more likely to have things like depression, and potentially that may be their presentation of heart disease.
And that's a huge that's a whole other can of worms in terms of how depression and mental health issues can actually negatively impact heart health. Well, listen, Dr. Sharon Rambahar, thank you very much for coming on the show. I mean, if our listeners want more information about the Heart and Stroke Foundation, where can they find it?
Absolutely. So the Heart and Stroke Spotlight on Women and some really helpful information is accessible on the Internet. You can look up heartandstroke.ca/women. The other thing you can do is join the Red List, which is the campaign to closing the sex and gender research gap in women specifically for heart disease.
Wonderful, wonderful. Thank you for that.
And Dr. Mike, just before we wrap up the show, if our listeners want to connect with you directly, how can they do that?
Well, they can visit us at applemed.ca. On Instagram, they can check us at Applemed Clinic. They can reach us at 905-417-4000. We're at 3560 Rutherford Road, Unit 45. And thank you very much for listening.
If you missed any part of Health is Wealth, go to our website, 1059theregion.com. I'm Tina Cortez. Thanks for listening.